Jennifer Kizner has been a speech pathologist for 26 years and at Stanford for 24 years. She achieved her clinical doctorate in speech pathology in 2021, is a board certified swallowing and swallowing disorder specialist since 2010. Currently, Jennifer is a clinical specialist in the Stanford Outpatient Head and Neck Oncology Clinic and is a member of the multidisciplinary team. She has presented on swallowing disorders and the SLP's role in evaluation and treatment of head and neck cancer at the state and national level, and currently is serving on the Government Advocacy Committee for Casha, where she is working on changing the language of the current fees bill at the California Licensing Board so that clinicians can have more access to performing fees in settings that are required. So it's a brave talk that Jennifer is going to share with us today about advocacy within speech pathology. Thank you, Jennifer.
I wish I had a cool title like Dr. Evangelista had, and next time I present, I'm going to work on a cooler title. But good evening, everyone, and thank you, Heather, for inviting me to talk on a topic that is very important to me. And thank you all for being here to support and bring awareness to Dysphagia Month. So here are my disclosures. So in the short amount of time that I have, I wanted to be able to define advocacy, talk about the differences between advocacy within our state licensing board, within Casha and within ASHA. I'll dive a little bit deeper into the fees bill that I was able to help work on, and then talk about ways how you can be involved in advocacy as well. And then I'm happy to answer any questions. So just to start with defining advocacy, which is really any activity that influences decision makers to affect outcomes of laws and regulations that affect the public. And lobbying is a type of advocacy work. I recently saw an article that said in California in 2024, the total lobbying expenses could be in excess of $480 million. And more specifically, so far this year, California Hospital Association and the Association of Hospitals and Healthcare Systems have already spent $1.2 million on advocacy work. So that's a lot of money, but I think we need our voices heard. And hopefully, as I go through this talk, you can understand why our voices need to be at the table and not just having legislators make decisions about how we practice. So I wanted to take a few minutes to talk about advocacy at different levels within ASHA, Casha, and the licensing board. And I know there's some folks maybe online who are not within California or even within the country, but I think that would maybe give perspective on how things are working here. So just starting with ASHA, of course, they give us our Cs. Most employers really require us to have our Cs and keep them updated throughout our employment. ASHA has 5 strategic themes, which are the main focus of the association strategy and the key areas which they must excel in order to meet their vision and their mission. And as one of these strategic themes are advocacy, and specifically advocate for accessible quality of care for all. So I just wanted to talk about the ASHA state-based advocacy networks. I presented a little bit on this at Casha, and I was really surprised that most people didn't know what this was. So the state-based advocacy networks include the state education advocacy leaders, the state advocates for Medicare policy, the state advocates for reimbursement, and they basically have state people who are appointed by the state association's president to meet with all of the others, star, stamp, and seals from all of the other states, and we meet with ASHA, and typically we meet with their lobbyists, and we talk about issues that affect all of us. And what's great is that, you know, if we have an issue, like if I have an issue with Medicare, I can talk to Teresa Yao, who just talked, because she is our Casha stamp. If there's any issues with Medi-Cal, I'm currently in that role. So you can, you know, use us as the conduit to say, hey, if other people in other states are having these issues, what are they doing and how are they handling it? So it's just another way to kind of be aware of the issues and maybe solutions that other people have that maybe you haven't thought of. ASHA makes it so easy to advocate. So if you don't want to be a stamp, a seal, a star, you don't have the time to do all of that, ASHA makes it so easy to advocate. So I went onto the ASHA website and I pulled up two of the ASHA advocacy tabs and topics that were of interest to me. Now, we all decide what's of interest to us. So every year, ASHA says, what is of interest to you? What do you want us to help with, right? What should we advocate for? So let your voice be heard when you get those emails from ASHA so that we can have other issues or topics that are of interest to you. But what they make it so easy is that you can log into this topic, click on your topic, and there's a pre-written letter to your congressperson or your legislative representative. And so to the right of the screen is pre-written letter. You sign your name, you send it off. It takes maybe a minute, but you've advocated, right, for something that is important to you and your practice. And I should probably just take a step back to say, when we're advocating, the bottom line is we're advocating for our patients, right? If we're advocating for us to have what we need to do our job, it's really to help our patients. So I know that this topic is slightly off what other people have talked about so far, but really it's all about the patient, right? Okay. So switching gears from ASHA to the state licensing board. So the licensing board clearly gives us, they regulate the practices of speech pathologist, audiologist in the state of California, give us our license. They can also take your license away if you're proven to participate in any unethical practices. The mission of the licensing board is to protect and advocate for the people of California. That is their overall goal. They are the Department of Consumer Affairs, right? So that's good and bad. But what is good right now in the licensing board is that we have some medical-based speech pathologists who are on the licensing board, so that when we come to advocate, we have other people who know the issues that we have, and they can be on board with us and really understand our specialty. And this is just a list of who is on the current licensing board. And Gilda Dominguez is the board chair, and she's a speech pathologist. She works in an ENT clinic. She does fees. She's a medical speech pathologist. So that's really exciting to have someone in that role that understands who we are as medical speech pathologists. Okay, and if you haven't, I would recommend attending one of the quarterly board meetings that the licensing board has. They're open to the public, they're online, they're in person. You can get the agenda. If you can't go, you can even listen to it afterwards as a recording. And if you have an opinion on anything, you can give your opinion. And you can also say, these are all great topics, but nothing that I care about is on this, right? And then you go back to your Casha representatives and say, hey, why aren't we talking about this topic? This is important to me. So it's good to see what the state is focusing on, what Casha is focusing on, and then what's important to you in your practice. And then finally talking about Casha, nonprofit, supports speech pathologists, audiologists, SLPs, and students. I have been lucky enough to be part of the board of directors and on the government advocacy committees over the past few years in different roles. And it really just opened my eyes to the need for advocacy, because I always kind of repeat the important things. I say that to my patients all the time. Like, I do just want you to get these few little nuggets. But I don't want anyone making decisions for how I practice who are not in my field and don't understand who we are and what we do. So I've been privileged to have an honor to have a seat at the table for some of these. The Casha Board of Directors consists of 10 district directors, and they're committed to maintaining a thoughtful, dedicated, diverse composition amongst its members with a focus on individual contribution to the board's shared governance role. What's really exciting about this year, and if you're a member of Casha, you just voted, there are 4 new positions that Casha has, and one of them is VP of Advocacy. 2-year role, and it's one person, and that is their job for 2 years, is to focus on advocacy for Casha. So that's a very exciting thing versus having people who were assigned to do something and maybe that wasn't their passion for what they wanted to do. I think there are a lot of benefits to being a Casha member, but I think legislative advocacy really is the top priority for me, if you can't tell from what I've been talking about already. So let me move to the next one. The Ballfrost group is our lobbyists. And I have had the pleasure and honor of working with Laura and Andrea, two ladies on the end there. And I talked to Andrea the other day and I said, I'm going to do a talk about lobbying and advocacy. And I'm like, I need a couple of words. And she literally sent me 4 pages of things. And I'm like, no. So, or I just can get up there and read your words. So what she said was, our goal is, as legislative advocates, is to raise the awareness of Casha and its capacity to be a resource for policymakers, legislators, agency and department staff, and the government staff. So they review all of the bills that come across, and their eye is there anything here that speech pathologists, audiologists, LIPAs would be interested in or should know? And then they bring that information to Casha. And then they say, is this something that you want to focus on or have the resources to focus on? So they're really our liaison. They're kind of like our interpreters, if you will. Whenever I'm talking with them and a legislator, I feel like they're always like, well, this is what they just said. I'm like, okay, knew it was English, but I didn't know. And I was really, one of probably the highlights of my career so far is that I got to go to Sacramento to advocate for our fees bill. And you have to have a senator or someone who's backing your bill. And so Senator Ochoa Boa, who's represents the 23rd District in Southern California, backed our fees bill. And we got to meet her and advocate. And on this day when Lisa and I advocated, I think the vote that they had was like 10-0. They all were like, yes, it sounds like everything you're saying we should do. Which again, they didn't know who we are, or they thought speech pathologists do swallowing, speech pathologists don't do this. So explaining who we are, what we do, and how we can improve the quality of life of our patients was really great to be able to do. Okay, before I dive into my last topic of the fees bill, I just want to give you a big picture of the legislative session. So a high level overview. Legislative sessions last for 2 years. There are over 5,000 bills that are introduced in the 2-year legislative cycle. And again, the Casha lobbyists review the bills, see if there's any impact on speech, audiology, also find committee members who might want to back us and help us out. So it might be someone of, oh, my grandmother had a stroke and saw a speech pathologist. Great, we'll grab them. Oh, my daughter's a speech pathologist. Okay. And they kind of find people who are interested enough to take on our role and move it through. For the bill to be enacted into law, it has to go through the appropriate committees in both the 40-member Senate, the 80-member Assembly, and receive enough votes to pass both houses and then finally go to the governor's desk. So when people get mad and say, well, why can't we just change this? It's a process. It's a 2-year process, and we have to go through a lot of committees to kind of get it through. So the last thing I just wanted to focus on was the fees bill. California has one of the most restrictive language on fees or flexible endoscopy of swallowing training in the United States. Years ago, the language for the fees bill from the licensing board was very unclear. And because it was unclear, there were a lot of interpretations of training and implementation. A big concern for a lot of speech pathologists is the need to be deemed competent in doing a procedure that is in our scope of practice by someone else outside of our scope of practice. Now, we love our ENTs, we love our laryngologists, we need them, we work together, but I don't think they want to have to spend the time to show us how to do a procedure that we do. So that's definitely a concern. Also separating scoping from the actual exam. Now, some people think, okay, maybe we need the physician to just help navigate the nose to get to the hypopharynx. Okay, but then actually doing the exam, do we need our speech pathology colleagues? And then there are, even if we wanted our ENT and laryngology colleagues and they wanted to do this, there are just not enough in the state of California compared to the medical speech pathologists to make that happen. So this is the committee that we worked with. It was so lovely to work with everyone on the committee, and then Susan Langmore. And just a little story, one of the legislative meetings, she like brought a scope with her, and she literally held it up and was like, this is all the hubbub, like this is what everyone's talking about. And everyone was just like, oh, like that's it. And then finally, our initial goal with the fees bill was to kind of clean up the language. The old bill said 25 scope passes how to be observed by the physician. Results of the negotiations with the California Medical Association, the licensing board, and Casha, the law was edited to now read that only the first 10 of the 25 need to be observed or signed off by the MDs, and the last 15 can be signed off by a competent speech pathologist who does fees. And then we also grandfathered in other folks who had already been deemed competent prior to the change in the law. But our long-term goal is to allow speech pathologists to train other speech pathologists in a, something that is within our scope of practice and that we do. Okay, so just to finish up, I would love for everyone to just be a little bit more active in advocacy. It really counts. Your voice matters, whether it's, clicking a few, buttons on your computer and telling your legislator what you want, or actually going and presenting in Sacramento. So hopefully this motivated you a little bit. Advocacy at work. Thank you.